let's go over all the ins and outs of medical fitness. In this episode of the KIPS podcast, I have the owner of MedFit, Lisa Dougherty, who is going to be talking about medical fitness, ins and outs of it, what it entails, because it's not just one thing. It's not just working with older populations. It's really important to understand that as a personal trainer. And Lisa's going to be talking about all the different areas, the importance of it, and also trainer evolution, especially for new trainers and growing your career. Now, in just a second, I'm going to bring on Lisa, and she's really going to dive into medical fitness. But there is a topic that comes up in the episode that has to do about business fundamentals. And I hope that you hone in on it when she mentions it and we dive into these things. But I want to go into a little bit more. Now, when you come into this industry, you kind of have options. You have either you're going to be working for a gym where they're doing all the marketing for you. You have your sales kind of laid out, and now you just kind of go through their process. But if you want to make a good living in this industry, oftentimes you are doing it on your own. Now, I made a video a bit ago about a business checklist for starting your own business as a personal trainer. I could put that in the description, but the importance of it has to do with making the client feel comfortable. If they are contacting you for a personal training services, what is your process? When they call you or you call them, what are you telling them? What are you relaying to them so that they know, okay, I know where I'm going. I know what I'm going to be doing. Now, when they come in, what kind of forms are you going to have them fill out? Or prior to that, after that, are you doing assessments, workout, all these types of things before you do your presentation of the pricing and then paying for them? Do you have that already set? When a potential client is handing over their credit card, their money for hundreds to thousands of dollars of personal training, do they feel comfortable? Think about these things. Have every single step planned out so that you can grow within this career. This career as a personal trainer, it can be lucrative. It can be great. Helping people reach their fitness goals is a great feeling. Let's now get to the episode with Lisa. Drop a comment on the area of medical fitness that you either work in or you want to learn more about. Lisa, for our listeners, can you give some insight into your background? How did you get started, what you're doing now, and just a little taste of what you have coming up? Because I know that it's a big thing and we'll talk about it at the end, but just a little taste of it.
Sure. Well, I started in the fitness industry 27 years ago. I changed careers in my 30s. I was in the securities industry, stocks and bonds.
Oh, wow.
For 14 years. And my dad was on his second cancer. And I knew I wanted to help people, maybe not with their money. And I've always loved fitness. I played soccer. I ran track. And so I had the opportunity to go back to school. And there was a 2-year fitness instructor program at the University of California, Irvine. I went back to school. And my goal when I graduated was to come out and work with cancer survivors and on my dad. And so anyways, I started my business before there was an internet. If all those watching and listening, or if you're old enough to remember that, I had to put flyers on car windshields and, you know, there was the yellow pages back then. There was nothing. I mean, you had to get referrals. So it was pretty. When I graduated and I started whole body fitness, I wanted to focus on what used to be called special populations. And that was a niche back then. And today, I think healthy people are special populations. You know, we talked about that prior. But I went on through a company called Desert Southwest Fitness, and I took 15 chronic disease and exercise specialist certificate programs. The company's no longer in business, but I became one of the first dozen chronic disease and exercise specialists in the United States a long time ago. And when the internet did come out and I had a website, SEO did matter. There was no Johns Hopkins University or Mayo Clinic. So if you Googled like cancer and exercise, I was number one on Google.
Nice.
Long time ago.
People pay a lot of money for that these days.
Right. And so I had people contacting me from all over saying, wow, you know, my daughter has, you know, type 1 diabetes. My mom has osteoporosis. And there was really no one but me around that had education in this space to do that. So anyways, my first year I made $18,000. I wanted to quit and go back to work. And by year 3, I made 6 figures and had 2 trainers working for me in that space. I made them take those courses, and we were a really strong team in Orange County, California, because there was no one like us. Again, finding your niche
Yeah.
is really important, and separating yourself from everybody else makes you stand out in your career. So that's how I got started. And I really believe education is important, and that's what made me stand out. So when someone looked at my resume, it was so easy for them to want to hire me because of all of my education and qualifications.
Yeah.
And or to get referrals from doctors or physical therapists. When you look at my resume of education, there was no question about that.
Well, that's great. And you hinted at a couple things that I'll have to say. I got to remember to come back to these items, talking about a niche and talking about finding your area of the fitness industry. But I do want to dive into some terms here, because I know that some listeners will be thinking, oh, special populations, that's what the term is, active aging. They just think it's older individuals. That is the only part of it. But I do want to set the stage of what is medical fitness? What would you call medical fitness for those listening?
So medical fitness is for anybody that's recently diagnosed, has had surgery, getting ready for surgery, has a pre-exacerbated condition of some sort. And we bridge the gap between that and mainstream fitness, or physical therapy and mainstream fitness. And, when you talk about active aging, realize now that people in their 20s have type 2 diabetes, or even teenagers. So it's not about being old, and gentlemen are getting prostate cancer in their 30s now.
Yeah.
It used to be one of whatever older aging, cancer disease. So it's not about your age. It's just about lifestyle and the environment right now. We live in a very toxic world of pesticides, herbicides, pollution, and everything. So that's just today's normal world. I mean, we're all getting stuff now.
Yeah. Yeah. A question that just popped into my mind along those lines, because I saw it in the last few years. A individual that I know had a full knee replacement, but she had done a handful of preparation for it. It wasn't, okay, I'm going in for my surgery, I'm just going to sit on the couch, eat whatever I want, and then after, I will get to my fitness. The preparation for it, so that after the recovery was quicker. That question, that whole setup for it, because I know a trainer listening, be like, oh, this does fascinate me. I do want to help people in my area. But the conversation of it, how would a personal trainer approach that conversation to tell somebody, no, like, you should be exercising in this period leading up to, if they were to have some type of treatment?
Oh, for sure. I've trained a lot of people prior to surgeries, even cancer. I mean, if someone was diagnosed with renal kidney cancer and they were overweight, out of shape, and they wanted to be able to go under anesthesia for the procedure. And, you got to, sometimes you have to, the doctor will ask for you to lose weight because of your heart or whatever. Or like you said, a joint replacement, doing prehab. I've done that many times. And then also too, once they get released from physical therapy, just keep in mind that physical therapists, they rehab a joint from injury and surgical intervention. That's all they do.
Yeah.
It's up to us as a trainer to take that new knee or hip and look at the whole body and get everything moving now that they have this new joint, or if it's a partial replacement or something like that, back together. So, that's a great niche too, just doing, joint replacement, because I don't know what the stats are, but it seems like, with my clients, it seems like everyone's getting their joints replaced now. It's crazy. So, and oftentimes when people get a joint replaced, a lot of it is maybe like obesity caused the joint to degenerate. And so the doctor will tell them they need to lose weight because you got a new knee and you got an old knee and you're still carrying all that weight, and you got to lose weight now and get healthier. So people will want weight loss after a joint replacement as well. So
all good areas
being
to
able
market.
to help someone after they get a diagnosis, and even people get diagnosed with arthritis, osteoporosis, and it's a shame that they don't do a DEXA scan for women until you're 60 to see what your bone density is. And I argued with my GYN. I said, isn't it kind of pointless? Shouldn't we start at like 50? Because then you have a chance to do something about it.
Yeah.
So, weight training is really important for women for prevention of osteoporosis, because you're not going to get that test paid by insurance until you're on the other side of menopause and you don't have good bones then. So there's just so many avenues and niches within the medical fitness space that you can help people. To me, I feel like there's more choices than just the healthy person that wants to go snow skiing.
Agree. Now my Instagram feed is a good amount of fit pros, people that I know in the industry, probably same for you. And so depending on their age, they have their niche already kind of nailed down. What are how would you actually rank maybe top 3 of the current most popular medical fitness areas right now to give trainers an idea?
Menopause, even though that could be considered active aging, 100% of women are going to go through menopause. 100%. Yeah. And who hires personal trainers? Mostly women. I think because men think they know what they're doing or whatever. So your clientele is more than likely going to be female.
Yeah.
And 100% are going to go through menopause. So knowing anything about that's going to be good. The osteoporosis, and women have cardiovascular disease just as much as men. So understanding, that diabetes is a really big thing now, and all the GLP-1 drugs that the doctors are giving out like candy. It seems like it. And you got to exercise. You can't just take that and expect to look beautiful at the pool. I mean, no one is walking around the pool going, wow, where'd you get that body? Oh, I took GLP-1 drugs. No, I was at the gym working out 3 times a week and I run and, eat vegetarian or whatever. That's how, that's the health.
You bring up a good one, and we'll only spend a little time on this because there's a handful of other items, but that is such a hot topic right now. And I see posts about the Ozempic body, Ozempic this, Ozempic that. And for trainers out there, how can they approach that topic of, no, you want to keep and build a consistent habit if you are going to take this as well, in terms of building strength, building muscle, and creating those habits potentially so that if you do go off of any of these medicines, that you will hopefully keep some of that muscle mass, keep some of that consistency in your routine. How can, in your opinion, trainers, I always go back to the conversation, because how are you going to get somebody in the door to hopefully train them and create these? What are some of your insights, tips for that?
Well, I would like to think all trainers have a website these days. And
I hope they do. I will tell you that I made a video about it and about making a free website, but it's not even that popular, but continue.
Yeah, you've got to have a website. And then you can get on Yelp or Nextdoor, or however you want to promote yourself. But you should have a lot of content on your website. It makes you look educated, and it sets you apart. If you get an email list, I've always had an email list where there's clients, and they forward it to friends, family, colleagues, that I send out a once weekly email on a topic. And it doesn't mean it from me. It could be Dr. Mark Hyman. Here's what he's saying these days. So it's not like I'm writing, emails every week. I'm pulling stuff from reliable, places. Dr. Peter Attia, what he say. And I have found a lot of people going, wow, that's great. I'm going to share that with my grandfather, or, my coworker at work would be really interested in this. So again, providing education and making a great website and having, a blog on there or stuff on there. Again, so if someone asks, I still carry business cards. I don't do the whatever the phone app here, scan my phone. And when someone is nice to me, I always give them my card. And I said, thank you for being nice. If I could ever be of service to you or your family, my card. And they look at it and they're medical fitness. Wow. And on the back, I had all the services I provide: arthritis, diabetes, cancer, prenatal, postpartum, menopause. They're like, wow, this is great. Thank you. I said, sure, if I could ever be of service to you and your family.
Yeah.
So I still do that.
Those are tried and true methods. And I agree that the word of mouth part of it, you never know. A friend of mine that you know as well, Ruben Perea, he told me once how he makes content. He doesn't make content for the 20 or 30-year-old. He makes it for their grandparents or for them to share it with somebody, because they'll be, oh, wow, this person that's younger is training active agers. Oh, I need to send this to my grandpa, my uncle, whoever that might be that is in that population. So I know that some trainers think, oh, my demographic's not on this app, or my demographic they don't care about these types of things.
Oh,
You never know who they're going to share with.
Who is your avatar? I'm going to use that word. We all know what that means. And for someone to afford your services, they probably need to make 75, 80,000 a year, 100,000, because you're like a car payment. So who's earning those wages? Probably late 40s, 50s, certainly 60s, have the disposable income to hire you. So your target audience is never anybody in their 20s or 30s, maybe their 40s. I mean, if they stumble upon you, but that's not who can afford you. So who can afford you ongoing for a long time and refer their friends who have the same income level are people that have had diabetes, cardiovascular, arthritis, osteoporosis, stress, mental health issues, cancer. That's who needs you. That's who has the money that can afford you. But you got to have the education behind you, because a lot of those people, they think of trainers as bodybuilders, or, they're going to make you do push-ups, or no pain, no gain. And so you have to separate yourself, that you're almost like a physical therapist. You're very educated. You come across very professional, and
I like that.
Intimidating. Then when people think of a personal trainer, they think of some young person may hurt them. And so they're really cautious, and they, but if you present yourself that way, it's much easier to get clients.
100% agree with all those, because I know that it was said to me, I think back in July, it was in July. One of my professors from college, Dr. Schroeder, mentioned how a student said to her, well, I don't look like a personal trainer. And she took a step back and thought, well, what does a personal trainer look like? Right. Big, buff. And there is this mental picture, but not everybody has that picture in their head and wants to train, exactly as you mentioned, wants to train with somebody like that. And so setting a base of education, setting a base of professionalism, just how you mentioned, those go a long way as well. I want to kind of keep...
Someone will really hire you that can afford you. Yes. And it's an older person that's just what it is.
Yeah. I want to keep with this thread here with the beginner, that somebody listening thinks, okay, I like this train of thought. I like that this could be a great area for me to step into. Education, yes, great. I need to find more education in this space. Would you recommend potentially shadowing a trainer that is in this area that they want to go into?
I don't know if you necessarily have to watch them train. I've had that. But if you can find someone that would be a mentor to you, I've mentored trainers where they just come and talk to me and have coffee. And I tell them what I did, what education I took, how I promoted myself, how I came up with my prices, how I track workouts and stuff like that. So I think just meeting someone like that, and you could go on the internet and search, personal trainer near me, and see if you can find someone that has, like maybe 10 years experience. I mean, that means they lasted through a lot.
Yes.
And they probably know a thing or two, because they've been around for 10 years. But I would recommend talking to that, or, through my project MedFit, we offer mentorship as well. So someone could actually do a 60-minute session with me, and I can look at where they are and see if I can help them grow within their city, wherever they are.
A quick break in this video. If you are needing CEUs, make sure that you head to the link that's in the description, where you can find all our online courses that have pre-approvals with NASM, ISSA, ACE, AFA, NCSF, and with Nesta. We of course offer free content on our YouTube channel, but if you're needing professional ed, with some of them even having the full amount to recertify, make sure you head to that link. And now let's get back to the video. I feel like a common theme that I've been getting through this interview so far is the business elements, having those set as a new trainer. I know that people that I've interviewed before, talked to, they don't emphasize them as much, not saying there's anything wrong with that. And I strongly recommend the business side of being a trainer. What are some areas that you feel like are missing in that area, that trainers, they don't think that this, whether it's not important or they think that they'll get to it eventually. But I mean, that's what the first year, in my opinion, should be.
To me, that's 99%. So there was a book called The E-Myth, and someone recommended it to me a long time ago. And it talks about, just because that you like to bake doesn't mean you know how to operate a bakery. And so a lot of trainers, because they like to work out, think they know how to run a personal training business.
Yeah.
And I think the stats in our industry is that 50% of trainers fail within the first 2 years. And that's never changed since I've been in the industry for 27 plus years.
Yeah.
So I think trainers, they're very enthusiastic when they come out of, they get a degree in kinesiology or biology, whatever, or they get their ACE certification, and I don't want to market. Well, your phone's not going to ring. And now you could go work for a gym for sure, and they'll do all your marketing and do everything, but you're going to get a tiny portion of the fee because they're doing the marketing, giving you all the equipment and everything else. If you want 100% of that fee, then you need to go and do, the marketing and something. Yep. I took the jacket off the book so I don't get it dirty. There was a gentleman named Phil Kaplan, and he started Personal Fitness Professional magazine a long time ago with Josh Floyd and Lindsay Vistola. And he talks about this book. It's a Harvard college professors have written it. And it's the most impactful strategic marketing business book like ever. And it talks about how to, right now, when trainers come in, they go into the shark infested waters and they all want to compete for the nearly healthy people. And the blue ocean is where there's little competition. And so I learned that a long time ago. I mean, I learned it because my dad had cancer and I wanted to work with cancer survivors. I went into that. There was no business thing like I'm going to make a niche and separate and do that. It was just I wanted to help people. But anyways, when you get a niche like this in the medical fitness, it is the blue ocean. You're really going to have no competitors. And that's just so good when you're trying to fight for your, your competitor's business. It is not good. So I highly recommend that book. It's a good read, and I'm rereading the latest edition. So there you go. They got to do business. You gotta do it, or you will fail within the 2 years.
100% agree. And the quote that I often use is that the turnover rate for trainers is 80% within 1 year. And I remember I brought that up to a gym chain owner in Bakersfield, and he mentioned that he thinks it's higher than that, just based off of his chains that he worked with, the trainers that he sees. And that's something that we need to work on. We need to do better. As I put it on education providers. I'm an education provider. That what can I put out there that helps trainers hit the ground running quicker, have more insight quicker, and hopefully stay, because it is a great industry. For all the things that you mentioned with helping people, it's a fantastic industry.
27 years, you know, and I have my own gym and I have a home and a car that's paid for. and a retirement account. I've had trainers work for me, but I just always focused on business. But I came with business background. You can always take some business classes at a college if that's something that you think would help you, or read some books. There's a lot of great books out there. I recommend it for business.
Spot on. Let me move us to the quick hits here for the podcast. And with these, I want your initial reaction. Okay. I'm going to read you a question or a statement, and you give me, some of them are ranking, but you give me that initial reaction. Okay. So here we go. First one here, Lisa. What are the 3 areas where trainers often falter in the first 3 months of entering the field?
They don't get out there and hustle and market. They wait for the phone to ring. It's not going to ring. No one knows you're a personal trainer.
Yeah. Give me one more.
Gosh, that is like the main one. If you don't do that, you fail. Again, the more education you have, the better you're going to look to the consumer.
Yeah.
So immediately after I went through that 2-year program, I started taking more education for the next 3 years. So for 5 years, I was really into education. I became an arthritis fitness vet, osteoporosis, diabetes. And that just sets you apart. So, a lot of personal trainers, they'll do the online course, whatever, it's $800 and you're a personal trainer. I don't know any other lifelong career that you could take an online course for $800 and become something for your life. Even like a car mechanic, they can't do an online course and become a car mechanic and work on your car yet. We as an industry can sell an online course, and we're working on people's bodies. So just know that online cert is not going to give you a career in fitness where you're going to make enough money to pay your bills.
That was probably the best response I've heard for, in past quick hits. I've asked the question whether it's experience or more education for a new trainer. And I think that was the best response I've ever gotten for the education route. And because they look at it in terms of, I already have XYZ, now I need to go. But would you say that your education built more confidence in that first year?
For sure. When people talk to me, or even if I met a doctor out in public, at a restaurant, I'm a personal trainer, and they ask me any questions, I came across very poised and confident. I think a lot of trainers are very insecure, and with good reason. You just went on an online course, and you're gonna make that a profession now? No. Not at all. You're just putting your whatever toe in the water.
I like the honesty. I do.
Yes.
Let me move us to our next one. Rank the following areas of personal training for a trainer that's been on the job for 6 months: assessments, finding a niche, and nutrition. Rank those 3 for me.
Well, finding a niche, and assessment, and I'm going to add on to that, like exercise prescription. Like, what are you going to do with that assessment? I think it has to be one. You could assess all you want, but what are you going to do with it? And nutrition. Well, in our industry, whoever they is, they say it's beyond our scope of practice to give nutrition advice. Yeah, there's all kinds of nutrition certs out there. So I always refer to a registered dietitian. So I don't give out any nutrition advice. That's me. But yeah, finding your niche, and, having some type of be able to design exercise programs. Again, I think when you're a new trainer, you did that online course, and there's very little exercise prescriptions. I'm belong in a bunch of forums, the ANSM, ISSA, whatever. And new trainers are constantly asking, well, I have this client, what do I do with him? Him or her? They don't know what to do. Again, that's where the education comes in.
Yep. I agree. Last one here. What is more important for career longevity for a trainer 1 year on the job?
1 year, you're still you think you know stuff, and you don't even know what you don't know yet at 1 year. And I look back, I think my 3rd year, I look back and I thought, boy, how stupid I was my first year. But I felt like, whatever. So, you think you know everything. You don't know squat your first year. You got a little bit of confidence now.
Yeah.
Keep going.
Yeah, I agree. The humility part of becoming a trainer
Yeah.
Whenever that finally kicks in for you, it starts to, I think, open up more doors towards education, different routes, trying new formats, different types of assessments, whatever that might be. Once
Right.
you get to it, once you become more humble and, oh, wow, there's not just one area of the fitness industry. There are so many other areas. I think it helps you with the longevity aspect of it. I'm going to move us to our podcast takeaways here. And this is our last question before we start wrapping things up. And with this one, you could take it wherever you want, of course. Okay. So what are 3 myths about medical fitness?
I almost want to ask you that question.
Oh, no. Can't put me on the spot.
I think because I'm in it, so it's hard for me to just figure out what someone knows or doesn't know.
Mhm.
But I think when I became new in the field, people thought medical fitness is I'm going to be working with people in hospitals or old people in nursing homes or
Mhm.
people drooling and whatever. And that's not what it is. Medical fitness could be, someone that gets diagnosed with, breast cancer in their 40s.
Yeah.
And, maybe they're a teacher and they're very, active as well. And they get this diagnosis. So I think medical fitness, they don't or trainers may not realize how medical fitness is just, if you have anything wrong with you at all, you need to know medical stuff.
Yes.
Anything. And
Yes.
all have stuff. We do. Everybody has stuff wrong with them. So you need to learn about medical stuff so you can converse, you could be confident, you don't hurt anybody, and you can do effective training based on whatever. They may have high blood pressure. Everybody's wearing, Apple watches and Aura rings, so they know their VO2 and their HRV and all that stuff. So you need to, learn all those things, but that's all part of the medical fitness space. When we started this conversation, I told you how I got diagnosed with invasive breast cancer last summer. And even though I'm really fit and lean, I had a great physical. The mammogram, everybody get mammograms out there.
Yes.
But anyways, just anybody can get a diagnosis. And one of the things I learned a lot about was HRV, speaking about this. And your heart rate variability is how well are you adapting to stress?
Yep.
And so I took a deep dive into that. So when I start working with my clients, when they arrived, I asked them what their average HRV was. And I was surprised how many of my clients were in the 20s. That was the average. Now, if you know someone my age, 40 to 60 is a good range. The higher your HRV, the more adaptable you are to stress, the happier you are, and so forth. And if you're 20 or below for many weeks at a time, you can have a cardiac event or stroke. And so I started asking my clients when they arrived, because mine was in the 20s for many weeks, and I had to fess up to my doctor that my HRV was really low. And he was like, you got to manage your stress. So again, there it goes back to the education, but anybody can get a diagnosis of any sort. And, we talked about me being the founder of the MedFit Project. And the MedFit Project, my first one was the MedFit Network. I started a professional registry and membership organization in 2013. I wanted to gather up any trainers that possessed any education like me, or had any interest in working with people that got a diagnosis. And I started the MedFit Network, and, people joined that. And what I discovered after creating this network is that there wasn't enough educated trainers in the United States to really make a huge network effect in all 50 states. And those of us on it, me included, there was no continued education. So even though I became an arthritis, fitness, and chronic disease specialist 20 years ago, there was no Con Ed on arthritis. So I started the MedFit Education Foundation, a not-for-profit, in 2017. And we deliver free webinars in this space, which are really cool. So you could listen to those. We started live conferences, the Medical Fitness Tour, I called it. It's kind of like the rock stars, Avengers coming to a city near you, medical fitness. The pandemic hit. We switched to online education, and I decided I wanted to recreate all that education I took 20 plus years ago. And we started creating online medical fitness specialist certificate programs, 10 to 20 hours in length. And then we're doing a virtual global medical fitness conference in October.
Yes.
And how that came about was after my diagnosis. I'm not cancer-free yet. And I realized how important this space is. And I want this to be a legacy project. It needs to carry on. This education needs to go on. I reached out to Josh Levy of the Fitness Business Association when I was going through all this testing. And I said, I want to do a conference. And it's not just the United States that's having a health crisis. It's the whole world. The World Health Organization states by the year 2030, there'll be 1 billion obese people in the world. 1 billion. Okay.
It's a big number.
We know with obesity, cardiovascular disease, diabetes, hypertension, stress, gut health, lack of sleep, whatever. And are trainers ready for that tsunami of obesity and illness? So I said, let's do a global conference. I want to unite all the countries in the world to come together. This is the first event of its kind. And I have 80 speakers. When I did a call out there, I was overwhelmed and surprised how many people raised their hand to be part of this inaugural event, you included, how important they thought it was. And so anyways, we're going to be doing it October 22nd through 26th. And because it's a global event, we're going to air it in 3 time zones to meet everybody. We're going to screen a documentary called Code Blue on the first night, and you can find it on Netflix and Amazon. And it's about a doctor who gets diagnosed with MS, and she has to go through the medical system.
Oh, wow.
And how eye-opening it was to her that no one asked her about exercise, diet, how she's sleeping, told her she's going to be in a wheelchair, and here's a bunch of drugs. And so this documentary, because I'm a not-for-profit, we got permission from Netflix to screen it the first night of the conference. It's free. So anybody can watch it. It's very inspiring. And I know Dr. Stanzik to this date, and she knows we're going to screen this documentary at the conference. But there's business stuff like you and I talked about in there, different niches in there, whether it be working with a group of Parkinson's or cancer survivors, to prenatal fitness, to with someone with cancer, learning about HRV, VO2, and heart rate, because it's all relevant now these days. And you got to learn all this stuff in there. So I'm really excited about it. And anybody who's watching this, I hope that you attend because you're going to learn so much. And then you can see if you want to do a deep dive into, menopause or cancer or diabetes, because you'll get a sampling of everything that you could do. And don't just do one thing, don't be really narrow. Do a bunch of, throw a big net. Learn a bunch of stuff and help a bunch of people. That's what I've done.
Oh, yeah, man. Before we wrap it up, I do want to say about these conferences, how, especially when they're online, that you can come back to some of them and how exactly how you mentioned, try things outside of that you never thought you'd want to learn about, to just get that taste and then open up your eyes to this can be a possibility. I think that is the beauty of conferences and reasons why you all of a sudden see, this, I have the wheels turning. I do want to go down this road. So great opportunity out there for trainers. Lisa, can you throw out some information for how people can find you on social media or website? And of course, there will be information in the description, but want to make sure that we shout these out.
Sure. Well, I have a Facebook page. It's under my name, Lisa Dougherty. And for the website, I would say medfitclassroom.org. And that's where you'll see all the webinars I mentioned that are free, and all the courses that you could take and become a specialist in, which is fantastic. And then the other ones through FBA, and I know you have the link. It's their website / I think MedFit, which I know you'll have in the notes. And I think you're offering a coupon discount code.
Yes.
So you could offer that too. Sign up. You could always watch it later if you can't attend live. To your point, you could watch something again. Since it's a multi-track, you got to pick one. So, if there's two you like in a certain hour, you could watch one live and the other one later. Or go back to it, because down the line, you may get someone that hires you and they get a diagnosis. Wow, I just got diagnosed with cardiovascular disease. And you can go, wow, I can go back to that conference and there was a session on that. And I could watch that and learn more to see, so I could help you.
Great example. I love it. Lisa, thank you for coming on the KIPS podcast. I really liked the direction you took it and all the information that you shared throughout this event. There will be information in the description for our listeners. Make sure that you click on it, check it out, sign up, watch it live, come back to it, grow your career, all that great stuff. Thank you again, Lisa.